Thank you. Thank you very much. Am I audible?
Yes, yes, very much.
So first of all, it's a pleasure. It's an honor to be here. I have heard, great doctors speak about, cancer and cancer care. Cancer personally has affected, I think most of us. I have seen my grandmother pass to it. My uncle passed to it recently. So I really understand the seriousness of this. And I thank you all for, allowing me to be here to share my limited experience in this. So yes, I think this is a very important subject in India. All the 7 pillars of cancer care, right from prevention, surgery, chemotherapy, radiotherapy, imaging, laboratories, diagnostics, and palliative care. All of them needs to kind of buck up. And I'm not trying to put it all on the government, because ultimately private sector has to come up. And there are some shortcomings, like how many radiotherapy machines do you have in India? I think it's not even 50% of what we need. So whatever limited way Alkem can do, we are trying to do. So I can do a presentation, a quick one, if that's okay. So I will not preach to the converted. You all know this far better than I can tell you all. So I'll just leave the high incidence of India and why this is such a critical aspect, where all pharmaceutical companies must come forward and move on this. So the incidence is really increasing. It's also got to do with better diagnosis, but I think there's a huge gap. When you look at the mortality rate, obviously, you just wish and pray that we all come forward and we do far better things. So this is the estimated cases of cancer which India is suffering from. And I would just on this like to digress and say that we are going to recently launch, soon going to launch cetuximab for head and neck cancer. So, we are trying to do, and even a launch of a new product might not seem like a public-private partnership, but in a way it is, because when you do clinical trials and you go through DCGI, you work very closely with the public sector. Yes, so state governments are adopting a public partnership model, and Alkem has experience about it recently, and I'll happily talk about it. But we all see the stats. The 95% of cancer centers are in urban areas, but 70% of the population is situated in the rural areas. So I think there is certainly a lot to do there. So coming to the main point. So Alkem has partnered with Tata Memorial Hospital for the state of Bihar, where we have executed 3 projects, large projects. One is the support for constructing advanced radiotherapy center at Muzaffarpur district. The second one is support for home-based palliative healthcare services in Muzaffarpur once again. And cancer screening and awareness, which I think is critical for winning against cancer or trying to put up a brave front, is screening, where we have put at 3 districts cancer screening and awareness at Buxar, Jahanabad, and Bhagalpur. So this is the one is obviously an artist reconstructed image, but the other one is a real picture. And we are trying to make a difference. We all know how many people come from Bihar, UP to Bombay because of lack of facilities. And if we can control that, we will think we have played a reasonable role in that. So we are also doing home-based palliative care services. We have just started, So we are one of the home-based palliative care services is one of the first kind services we have initiated in Bihar. The team consists of 1 doctor, 1 staff nurse, and a counselor. They visit the identified patients' home and provide their services on a daily basis. And this is completely given free of cost. 100% of the patients are below the poverty line. So cancer screening and awareness, we are doing it at those 3 districts. And you will see that it is a small thing. We are no way saying that it's making a huge difference, but it's a beginning. We have done community cancer screening at 264, awareness campaigns 24, and capacity for building workshops of healthcare workers 46. This is till December. And Buxar, Jahanabad, and Bhagalpur, all we are doing, and we will increase this in the next few months. Yeah, these are just glimpses of pictures what we have done. And yes, so that's from my side. It's just a beginning, but we'd love to participate more and hopefully make a difference. Thank you.
Thank you so much, sir. And it's been an honor to have you today here and learn, what corporate or, the private players are doing in terms of this shared mission of eliminating or reducing cancer incidences in our country.